Hello and welcome to our live hangout today called Acne Scar Treatment Update, which is adding the Infini to a new combination treatment. And today we have Dr. Jeffrey Rapaport. My name is Craig Uren. I'll be your host as usual today. Now, in today's hangout, you're going to get an update from the latest technology advances and innovations and treatment protocols for acne scar treatment using Infini targeted energy technology. Good morning, Dr. Rapaport. And
Good
welcome to
morning,
the
Craig. It's
Hangout
great
today.
to be with you. Haven't seen you in a while.
Yeah, well, nice to see you. Now, I know we did an acne treatment, acne removal webinar about a year ago, if not more. And in that one, you showed us a lot of the different types of scar depths, and you showed diagrams of different scar types. And at that time, you showed us a lot of different methodologies because you have some very unique protocols. I know people come from all over the country to see you specifically for scar treatment because you have some very proprietary protocols. So moving forward, the last 18 months, what's the new latest update with acne scar treatment that you want to share with us today?
Well, I'm glad you have me because we have some terrific new technology for acne scars. And the beauty of the new technology is that it enables us to treat types of scars that we really couldn't treat before in a natural way, meaning that their long-term results and their permanent results. And the new technology that I'm referring to is called the Infini. Now, the Infini is a radio frequency device that's different from any other previous radio frequency devices, and I've had plenty in my years that I've been treating acne scars, in that this device has the ability, because it has micro pins on it. Could you just show the picture of what the device looks like?
Let me just, I'll just have to pull those images up. So you want to show the picture of the actual device itself?
Yes. Mm-hmm.
Okay, I'll just have to share the screen. Let me just pull up that particular screen. All right, so
I want everybody to look at this device because it is really unique. It was developed in Korea by some expert Korean scientists. And the key to this device, if you'll put the pointer on the actual tip of the device, is that there are 49 gold-tipped micro needles there. Now, microneedling is not the newest part of the technology because I've been using microneedling for a couple of years now. However, this microneedling is different. These microneedles are gold tip, and what they do is that little square box has the ability to go in and out. So with that ability, we can control the depth that the microneedle goes in. Now, the depth of the microneedle is important because what we can do with the microneedle is release radio frequency, which is basically going to be heating the skin up at various depths and under extreme control. Now, if you could show the next slide as to how the needles, when they're placed, can controllably heat up the skin.
okay, so show the skin.
Show the skin diagram.
Okay, just bear with me.
Okay, so here we see on the left is the square part of the device with the microneedles extended. And what we can do here is we can control how deep the microneedles will go so that we have a very fine, delicate depth gauge. And what we do is we can release the energy at different depths. This gives us a multi-layer approach. We can do multiple passes, and it allows us to keep control. And I think the key here is with past technology, such as lasers and monopolar and bipolar, all the other devices that were out for radio frequency, we always had to work from the skin and we had a hope that the depth was right, and we had to work from the skin in. Here, we are penetrating the top layers of the skin, and we have depth control that is unequaled with any other radio frequency device. You can see on the right, when the device has let go, you have the epidermis is spared, the top part of the skin on the right, but you have these various zones of stimulating volumization. And the way that the treatment works is in acne scars is it goes in, it breaks up the acne scars, and it also breaks up the tethers, but not as much the tethers as much as breaking up the depth of the acne scars, and lays down this heated area which contracts the skin and can lift up the acne scars. And you know that in the past, I've always say one of my favorite terms is that lasers don't lift. And here we have a situation where we can actually lift the scars from underneath, which no laser or previous bipolar, monopolar, or any other radio frequency device has been able to do. And let's go back to talking you and I. So the ability to control the depth of the treatment and to lift up the scars using microneedles is a totally new concept. I'm going to, since you're showing the pictures, I'm going to show what can be done by treating acne scars with this device. And let's go back and let me give you a little bit more history. The one thing I do want your listeners to understand is that the basic concepts have not really changed. And the basic concept of dividing up your acne scars into the 7 types of acne scars, which I showed on the last chat that we had, still exist. And I'm not saying that this Infini works great for all different acne scar types, because it's just a very nice addition to our multimodality treatment for acne scars, but it allows us to fill in something that we were not able to do before. So remember, when we have scars that are depressed, the gold standard for depressed scars is subcision. So what I will do with subcision is take a small needle and go in and break up the tethers that are actually holding the scars down. By breaking up the tethers, it allows the skin to lift. In the past, we would do subcision together with some sort of laser, but the lasers were just to round the edges out. Now we use the Infini device to work with the subcision to both cut the tethers, and this allows, by putting in the Infini, for the skin to actually lift. No laser can lift the skin. The subcision can lift the skin a little bit, but now when the tethers are cut and the Infini is used, we're getting significantly increased lifting of the skin for depressed scars. And this is a whole new paradigm that we never really had before. Lasers, I think, are very good, and so is microneedling, plain microneedling for treating superficial scars. However, we really didn't have anything to handle these deeper scars where we could get really superior results in fewer treatments. The subcision works very good, and I have a lot of happy subcision patients. However, this makes the subcision sort of supercharged. It lifts up the area, it gives a flatter area, and it gives a more extensive result.
I heard you say the word fewer treatments. I mean, I know people, I don't particularly have acne, but I know people who do, and I know having a treatment to get rid of acne can be a life-changing experience for a lot of people who are conscious socially, corporately, etc. So anybody who is suffering from acne wants to get rid of acne fast, ideally. Probably tried a lot of different treatments over the years. When you just mentioned the word fewer treatments, does that mean that the new treatment protocol that you're using with the Infini, people will see faster results? How do they, is it faster results? Is it better results, better and faster results?
It's better and faster.
Right.
Now, I'm glad that you brought this up, because If you look at most of the videos that are out on Google or YouTube, or you look at a lot of doctors' statements, etc., they are based pretty much upon the original outlook that the company had taken when they released the device. Now, I work with the PhDs and the scientists and the people who are developing new protocols, and I speak to them every week. They come over and watch my treatments. They ask me for advice. And for the most part, most people who are doing the Infini are doing multiple sessions at lower powers and taking several times to get to the results that they want to get to. What I have been working on with the senior management and scientists is protocols to treat in 1 or 2 treatments, which means faster and better. And the advantage of this is that, number one, I have patients coming from long distances from all over the world to treat acne scars. And they really can't stay around for 4 to 5 or 6 treatments in order to get the results that they want. So we have developed protocols to work in a shorter period of time by being a little bit more, I don't want to say aggressive, but I want to say a little stronger in our treatments, in that we have studied settings with the team at Lutronic, and we know what the optimal settings are to get the most volumization and the most heat into the skin. And with these new settings, we are able to treat people in 1 or 2 sessions where most other doctors are using 4, 5, or 6 sessions. So if your listeners go and look at what other people are talking about, they're talking about multiple sessions, whereas we're talking about doing it in 1 or 2 sessions. So you must be able to separate the two into the 2 treatment protocols or the 2 treatment paradigms. If I have a patient that's local and wants to be treated 5 or 6 times, we can go with that technique. However, in my experience, most of the people would rather take a couple extra days off and have the treatment be a little stronger and do it in less sessions. So it's important that if you look at what's out there, which is some of the information from the company, which will change, by the way. This morning, I even had a conversation with the chief scientific officer from the company and all the different protocols, and he's working with me very closely. You will see that change into almost a bifurcation. Either people want to do the slow method, which is more treatments at lower numbers, or a little bit more aggressive or a little bit more concentrated treatment at higher numbers, and be prepared to take a little bit more time off, but get the results quicker and get the results more substantial as far as my results and pictures are showing.
I'm glad you covered that, because I did some YouTube. I always use YouTube and go and have a look around YouTube, and I know there was a lot of the videos were a few years old, and they were talking about these multiple treatments. So I'm glad you covered that one.
Well, the other thing I want to mention is, if you look at the other YouTube pictures, these are doctors that are just using the Infini alone to treat acne scars. And I think you know from my past chats that really is not, acne scars are not a one-size-fits-all shotgun type treatment. Right. And you have to divide the scars up. Not all scars, in my estimation, do great with Infini. The more superficial scars do not do so well with Infini. Sometimes we have to add a fractionated laser. Sometimes we have to add pure microneedling. Ice pick scars I've not found do very well with Infini. So you have to use the Infini as a very fine tool when it is appropriate. It's not going to get every type of acne scar, and it's not going to clear every face that has acne scars. It has to be used appropriately, sometimes with subcision, sometimes with microneedling, sometimes with Fraxel laser, sometimes with Fraxel repair. There are a lot of different ways that you have to use it, but you can't have a one-size-fit-all that some people are proposing, for Infini. I think it's important that you pick the type of scars and you treat certain types of scars in certain ways. And combine modalities for acne almost always works better than trying to use a single modality.
Right. Yeah. Totally get that one. That's why you're the expert.
Well,
I see people advertising. They just use Infini, or they just use this laser, or they just use this one protocol, which doesn't really get the results that these multiple modalities.
Well, what do they say, Craig? If you only have a hammer, the whole world looks like a nail, right?
Right.
We have all different techniques that we use. And in some people, I use 2 or 3 different techniques. I'll do the Infini one time. We'll see how it responds. If it doesn't respond totally the way that we want, or we don't get wow type results, then we'll add something else. We're constantly doing multiple modality treatments because that's the way. I still strongly believe in subcision. I strongly believe in the fractionated lasers, although fractionated lasers are, I think, in the future going to be used less and less and less, because it's more, they only penetrate, remember, your laser can only penetrate, if it's a carbon dioxide fractionated laser, 1.2 millimeters. I told you that the Infini, I didn't mention how deep it can penetrate, but it can penetrate up to 3 millimeters. Now, your acne scars, you're not going to treat at 3 millimeters unless there's some problem down below and there's a loss of fat. But for the majority of them, you can do multiple layers, and you can get down to 3 millimeters, or do 2.75 or 2, or etc. And you can't get down that low with lasers. So you're going to see in the future, not only with acne scars, by the way, and I want to come back and do a skin rejuvenation session with you also, that the microneedling radio frequency is going to take the place of lasers in many, many, many problems that people face in terms of cosmetic dermatology. And I think that lasers are going to be phased out, with the exception of treating the very top of the skin. And I think that what's going to happen is controlled microneedling is with Infini and other devices that may be around the corner, where we can control the depth of the release of the energy, and we can treat from the inside out instead of the outside in, is going to be the future.
Well, I look forward to doing that session on the skincare and Infini. Now, I'm eager to see some pictures.
Okay, I'll show you some Infini pictures.
Can you walk us through? Let me just pull these pictures up, because I had a quick look, but I'd love you to walk us through these particular case studies and show us these results. This should be showing on the screen now.
Okay, this is an Infini patient. This was a multiple session patient. And you could see with the Infini alone that the improvement in the acne scars has been substantial. But this is the type of patient that you can't expect to get treated in one session, because you can lift up the deeper scars with one session, but you have to do more for the epidermis. To get the epidermis, you need to do multiple treatments, and it can't be done usually in one session unless you use multiple modalities, or if you use the Infini in multiple sessions. Next slide.
Well, it looks fantastic result, does that to me.
Now, this is a deeper type of acne scars, and this is the ones that I'm talking about do terrific with the Infini. We're talking about the saucer-shaped scars, and we're talking about lifting up saucer-shaped scars with the Infini by going and treating from the inside out, making 3 passes at different layers, increasing the volumization and getting the skin rejuvenation process, and actually tightening the collagen so that you're getting a lifting and the depressions are going away.
Yeah, looks fantastic, that.
This is the same concept, deeper scars, but you'll notice that these type of scars are smooth-walled scars. Those are the scars that do the best. If you'll see the 2 little scars in there that are squared scars and more superficial, that's what I was referring to. They are more superficial, and they don't really respond as well to the Infini as using the Infini plus some sort of laser on the skin, or plus a very concentrated straight microneedling, etc. But the deeper scars definitely do lift up. So I want to point out the difference, that the more superficial scars are still there, but the deeper scars have lifted. Next slide. This is someone who has box scars and deeper square scars. You'll see the deeper stuff is up again, but you'll see on the superficial surface of the skin, there still are some superficial box scars and there still are some superficial scars. So if you ask me what is the weakness of the Infini, and this is, I wouldn't call it a weakness, it just goes along to what I've been saying all along, that you can't treat every type of scar with one type of device. This did lift up the deeper stuff. However, the more superficial squared out scars, epidermal scars, can still be improved with either Fraxel laser on the surface, microdermabrasion. We do microdermabrasion with PRP, platelet-rich plasma. I think you know I'm big on PRP. And there are still things that can be done for the lady on the right. Some patients would be totally happy with this, and other patients would probably say, I want to do some more. Let's have the next slide. This is a slide of Bob Weiss, who was a colleague of mine, and some of the other slides I did borrow from some colleagues. What I want to show you is that even severe scarring like this gentleman can improve with the Infini. Now, the one thing that I also wanted to show you is you'll see that his cheeks with the deeper part are significantly improved. But what needs to be done is the area with the ice picks, like between the eyebrows, and the other areas that have left more superficial scarring still can be treated further to get additional improvement. And the additional improvement that we can get with this is that we can fill out the ice picks and we can get the superficial scars to go away significantly, so that even though this is a really severe case of acne scarring, the Infini alone got the deep stuff. We need to get the more superficial acne scars with other modalities, and it can be done.
Right. Yeah, it definitely looks a severe case, but certainly looks a lot of improvement there.
I just did a fellow yesterday. I just saw him yesterday, and I didn't have time to get a release on his scars, who has exactly the same thing. And we were able to get the deep stuff. We're now going to have to go and smooth out the more superficial things. And for people who really want to get a complete, not a complete, because you can never get the skin completely normal, but who want more treatments, we're going to go back and do some additional things.
Right. Okay. So, well, I've got a few more questions. I think those results, well, they certainly surprised me. It's nice to see results. I mean, I don't have an acne issue, but for people that do,
well, acne is a devastating disease for people, and I can tell you that it's very gratifying for me, because I have patients that come in that won't even look at you. They're very depressed when they come in. They never smile, etc. And when you're done with all the treatments, their whole personality changes. It becomes a whole different situation for them. They become more outgoing, and it's very gratifying as I see this. And it's from all parts of the country, and even people I have coming from overseas. It's the same sort of thing. When we get them to the point that in their own mind they feel more self-confident, their whole personality changes.
Well, having worked with a lot of doctors myself all over the US and the worldwide, particularly in the plastic surgery, dermatology, anti-aging field, I know a lot of the work that you guys do is not just, it's not just physiological. It's in many cases predominantly psychological, as you say, the results that you get for people, and life-changing results.
Yes, it is.
Some of the stories I hear, people that just won't go out of the house for 20 years, and all of a sudden, whatever the rejuvenation was, whether it be facially or body or whatever, they now have the confidence to engage in social activities again. So I totally get it. I've got certainly a few more questions.
Sure.
I'm looking at, people have asked me, well, okay, so you can have this treatment that's, now you have these protocols where you don't have to have multiple treatments over a period of time. You can do a lot of the work in just one session. But what's the like recovery downtime of these different types of protocols?
It's a
Is there
completely different.
downtime with this type of
It's
treatment?
the downtime is completely different with the more concentrated protocols. If you read what other people are saying, they have 1 day of downtime, very little redness. When you do a more concentrated treatment, you're talking about anywhere from 4 to 7 days of downtime. You're talking about having some redness, which means that people with skin of color or darker skin need to pre-treat with bleaches. You're talking about having some swelling. The downtime is significantly longer. There's no way to give a more concentrated treatment without increasing the amount of downtime. But you give people a choice. And if you give most people a choice about, I have some patients that are on television, and for them, they'd rather not have the downtime. They got to be on TV every day. So for those people, we can do a mild treatment. But for most people, they say, I want the most aggressive treatment that you can give me because I want to get rid of these things as soon as possible. And for those people, the downtime is in an average of somewhere between 4 and 7 days.
Yeah, and particularly for those people coming in from out of state or from different countries, they want to be in and out, don't they? They don't want to be hanging around for weeks.
They don't want to be hanging around for weeks. They want the results that are going to be in the fewest amount of treatments, and they're willing to put up with the downtime. Exactly. But it's totally different. As I said, you look at the YouTube and you look at the other things that the company has said, because that was the original protocol. This is evolving. I'm giving you the newest of the news, because right. This is an evolving protocol. This is a protocol that not all the doctors want to do, because this one thing that I think is very important, and a lot of the doctors like the mild multiple session protocols because they themselves don't do the treatment, okay? This is something that's very interesting. They have estheticians and nurses in their offices who end up doing the treatment. Now, I do all my Infini treatments. I have colleagues that have tried that. They've given the treatments to their estheticians and other things and done it very mild, and they haven't really been happy with the results. They come to my office to observe how I'm doing it because they are not seeing the results that they want to see with the estheticians doing the treatment. And for doctors' offices that want their estheticians or their nurses or whoever to do it, they can't really do the aggressive treatment because it's takes more skill, number one. Number two, it has to be done exactly according to protocols, and you have to assess the skin depth. There's a lot of issues: the skin depth, the type of skin, the degree of scarring. So for a doctor that's handing off and delegating the procedure, the more concentrated protocol doesn't work, because it's much more sophisticated, and the doctors are not going to give it to their associates. Whereas I personally, in my office, do the treatment. So I know exactly what I want to accomplish. I know exactly how much I can do, what the energy settings. I have to look at the skin that the patient has. I can make the assessment as to the numbers that I can use, the different delays. The machine, fortunately, is very, very variable, which is good for me because it allows me to do the treatments in a lot of different nuance. But for people that are delegating it, it becomes more of a problem, because when you delegate it, you have to have pretty much very similar protocols. And I find that that's why I seem to get better results, because even though I'm doing it more aggressively, I'm doing it myself, and I'm able to treat as conservatively or as concentrated as I need to.
Well, I'm glad you brought that point up, because whenever I go to doctors, and you take family members and you go with friends, and you go in and you talk to the doctor, and then when it comes down to the treatment, you're actually just being totally delegated to somebody else, and you think, am I getting the real treatment here? Where's the expertise? So I'm glad you brought that point up, that you do all your own work.
Well, I've been approached by the doctors that come in and watch me are the ones that want to do the treatment themselves, and they want to do it a little bit more intensely. The company has set up protocols so that you can pass it off to estheticians and RNs, and that's why it's a very light treatment, and you need multiple sessions to get to the same results. In my opinion, you don't get to the same results, but some of the pictures are very helpful, do show nice results. However, I think on a routine basis, unless you're doing a little bit more of a concentrated treatment, I don't think you're going to reach the same end result.
Right. Well, my last question I have, unless you certainly tell me if there's certain things that we haven't covered that you want to cover, but the only other question that's come in to ask yourself is skin types, skin colors, particularly. Is there any certain candidate or skin color type that cannot have this treatment, or is it for all skin color types?
This treatment can be used on all skin color types. However, when you have the darker skin color types, I have found that it's important to pre-treat those people with bleaching creams and other sort of pre-treatment regimen so they don't develop something called post-inflammatory hyperpigmentation or post-inflammatory changes. So we do treat all different types. What I may say also is that I may not treat as strongly for people who have darker skin types, but I have to see what their pores look like, what their scarring situation is. In the past, have they had any treatments? There's a lot that goes into it. But in general, this Infini can be used on all skin types. Certainly with the milder multiple sessions that are being done, that is a total given because there's really not that much epidermal injury. But if you're going to do a more concentrated treatment, I feel that it can be done, but you need to pre-treat the skin. And that's something that we do routinely.
Oh, excellent. Well, I've covered all my questions. I found this very interesting on the acne update on the new latest protocols and technology for acne scar reduction. Is there anything that we've missed?
Well, the other thing is I participate and answer questions all the time on different blogs and websites. For instance, one is called Real Self. I think it's an excellent website. And what I do is I'm constantly running across people with a lot of questions. And the answer to a lot of the questions ends up being one thing that's very important. And that is, if you're going to have acne scars treated, you need to go to someone whose practice specializes in acne scar treatment.
Right.
Not someone who is just got themselves a new laser or just got themselves a new device. Because as I said, all acne scars are not the same. And acne scar treatment is really a specialty. And you certainly need to see someone who is board certified. You need to ask to see pictures of before and afters of patients that the doctor has done. You need to ask who is doing the treatment. Is it being done by the esthetician or is it being done by the doctor? How many treatments the doctor has done with this? The photos, as I said, how many years has the doctor been doing this sort of treatment? All these things are important, and you should look to see people that have similar types of scars to what you have, because as we discussed, the type of scars that you have need to be treated differently. So you want to see someone who has scars that are very similar to your types of scars. And you want to see a board certified expert in acne scars when you go and get your treatment for acne scars. And ask a lot of questions, because when you have a consult, I'm always informed, and I like people to do their research, because an informed person is much more understanding of the nuances of the treatment.
Well, that's great advice. That's perfect advice. Well, I would say to anybody who is, I think we can conclude here, but anybody who certainly has acne that's on this hangout and is looking for a solution, I'd certainly take Dr. Rapaport's advice. I know you give a free consultation. What I suggest is you go to the website, Cosmetic Skin, So go ahead, go to Cosmetic Skin, call Dr. Rapaport's office. His friendly staff will book you in for a free consultation. It's not going to cost you anything. I know you've got practices conveniently in Engle Cliffs in New Jersey, the Cosmetic Skin and Surgery Center, and it's only minutes away from New York City for all those people up in the Northeast. So go ahead, give him a call, go to the website. And if you found this certainly helpful, please make sure that you comment and share this hangout. But today, Dr. Rapaport, I certainly appreciate your time and energy, and you constantly advancing the acne scar reduction industry. I know you're a total thought leader and luminaire in this field, and we appreciate and we're honored to have you on this call.
Well, Craig, it's great to see you, and I wish you a very nice afternoon and good health, and take care.
Thank you. Bye-bye.
Bye-bye.